Hi, I am Dr. Saravana Kumar, Senior Consultant from Gem Hospital, Coimbatore branch. How we are going to define obesity, the parameters. Whenever we are seeing the patient, like suppose two of the friends coming together, one patient weight is 80, the other patient's weight is 80. If both of them are normal weight or obesity, how we are going to define? All depends on height. That means height and the weight ratio. It's called as body mass index, BMI. This is the most important parameter to define the obesity. And according to that, WHO has classified this BMI into the category of either normal or overweight or obesity. And under 25, the BMI is being calculated by weight in kg and divided by height in meter square. And suppose if the BMI is less than 25, that is normal. 25 to 30 is overweight. More than 30 will be called as obesity. That will be classified into class 1 obesity, that is between 30 to 35, and 35 to 40 will be called as class 2 obesity, and more than 40 to 50 will be called as class 3 obesity. And after that 50 or 60 will be called as super obesity or super obesity, mega obesity, so on. Why it's being defined like that? Because once the BMI is crossing more than 30 or 32.5, that means class 1 obesity, the chances of getting into that, like diabetic, hypertension, pressure, that means the sugar pressure, cholesterol levels, and which causes some sort of like hormonal imbalances, like PCODs, infertility. These are the major problems can occur in that particular patients. That's why it's being defined by BMI. And along with that, there are one more parameter that is called waist circumference. If the patient is a female, if it is more than 80 centimeter, then she'll be called as central obesity. Same way for a man, more than 90 centimeter, it will be called as central obesity. And every time, whenever I'm seeing the patient, that is post-bariatric patient, and immediately they are asking that, what are the things I can eat after the surgery? And even the preoperative itself, most of the patients worrying about that eating factor, whether I can eat this one, that one, or my things will be reduced. I can't eat puri or chapati or naan, something like that. The thing is, whenever you are getting into the weight loss program, so weight loss program is not a cutting and doing suturing and coming out of that theatre team. This is like a lifetime follow-up. You need to have a lifetime follow-up. For that, you might require a regular commitment to follow certain principles, and you should have that discipline. That makes sense whenever before the surgery itself, that discipline should start. That's why the lifestyle modification, which includes diet as well as our eating pattern. And the eating pattern, even whether you underwent surgery or not, doesn't matter, but always have to have high protein, low fat, low carb diet, and which has to be taken every 4 hours to 5 hours gap. This means we'll have a proper diet plan, and this will reduce that your acid peptic disease as well as your constipation and all. Same way, after surgery also, it has to be reduced to the little bit smaller portion. That's why whatever you are eating, you have to concentrate on the proteins, high protein, rather than going for carbs or fat diet. This is what, if you are keeping in mind that, if you are able to do this one as a disciplined manner, surgery will be always successful for you. Thank you. Treatment jaruri hai.